Welcome to DecentMed Presents Hormone Health with Dr. Brown. Dr. Brown will be our headline speaker at our upcoming summit on Tuesday, July 28th, Women's Health Summit, Take Charge of Your Health. Dr. Brown is a functional medicine doctor that specializes in pelvic pain and endometriosis. Dr. Brown, tell us a little bit about yourself and what led you to dedicate your career to helping women with endometriosis.
Hello there. Well, I was a double-boarded family medicine doctor when I came out of residency, excited to, start my career. But very shortly, I kind of got frustrated or really disappointed in the symptom care approach, when it came to medicine. And so I knew that wasn't something that I wanted to do long term. I knew there was a better way to do things that fit me, my style, my philosophy, because I do believe the body has the ability to heal itself. That's the osteopathic principle. So eventually I found functional medicine, and it was my female patients that really got me involved, looking into women's health and going down that journey, learning about functional medicine, the endocrine system, the GI system. I loved, what I learned. Eventually just really started focusing on women's health. They were the ones who came to the practice most frequently. Women tend to be the ones who go see the physician, more frequently. They're the ones who are having issues. They were the ones who, had been basically, disserviced. People were not listening to them, the gynecologists, their own primary doctors, initially, and I saw the frustration, in them. And then eventually, a friend of mine, she was struggling, with some mood disorders. And eventually she told me she had endometriosis. And I said, well, I think I can help you with that. And, she looked at me kind of, funny, it's like, yeah, I never heard anybody say that before. And I said, yeah. So she told me she was on birth control and she had to get off the birth control. And when I told her she needed to get off the birth control, she had a look of terror on her face. And that really struck me. I hadn't really focused on endometriosis before. I'd heard of it, but it wasn't anything that I put any time or attention to. But the look of terror, that got my attention, made me start looking more into it and how many women were affected by endometriosis. And I saw there were so many women, suffering from that, good 10% of the reproductive age population. And I know it's a underserved population and there's a huge need there. And because of that look of terror on her face of actually thinking about having a period again, really terrorized her. And that really got my attention. And that's like, wow, it must be really bad. And we tend to, underestimate the amount of pain that women suffer, when it comes to endometriosis or adenomyosis. I think we just suck it up. But this is like next level pain, where she was, terrified of the thought of having to come back again. So that's what really made me started really looking, paying attention and spending a lot more time focusing on and helping women with endometriosis. And so that's what I've been doing, for the last few years, as far as, helping and women with that horrible condition.
100%. And something that you mentioned is that it does affect 10% of women. That's 190 million. And I think what separates functional medicine from traditional medicine, or one of the main things that separate it, is the extensive use of testing in functional medicine compared to conventional medicine. So applied to something like endometriosis, and we look at traditional medicine, why does it often take years for women to receive a diagnosis?
Yeah, that's a great question. Well, first and foremost, unfortunately, too many women, are not, they're really dismissed at the office. I've heard story after story after story. They just, they're not listened to, it's a 7-minute, conversation. They've been told they just have depression, they're offered antidepressants, they're not really taken seriously. And sometimes they don't even want to go deeper as far as testing goes. I've heard that from, several women where they weren't even interested in doing additional testing to figure out what was going on. All they want to do is just put them on birth control. That was the answer. And unfortunately, that's typically, the only answer that there is when it comes to endometriosis or a lot of other hormonal imbalances is either birth control that's going to suppress your natural hormones, just to have an artificial period. It's going to be antidepressants because women can be emotional and maybe they're just depressed, and put them on antidepressants because it can also help with pain. And then you have surgery. Really there's not a lot of options when it comes to women's health. So unfortunately, that's why you have a lot of people who don't want to go deeper into looking for it, because really it's going to be one of those three options anyway. And if you try the first or second one, it doesn't work, well, you can go to the third option anyway. So what's the point of even going deeper with it? That's what I'm assuming is happening, when it comes to these conversations that they're having with, some of their physicians, and so without, spending the time wanting to do the testing, well, you're never going to figure out, what the underlying, cause is. And so unfortunately, we know that it can take 7 years or more, for someone to get the diagnosis that they're looking for, so they can start that, healing journey. But, that's it. So people just not listening. They're not being heard. They've been dismissed for too many years, and unfortunately, that's the case. And so, until you find the right person that's willing to, look under the hood with you, and take that journey with you, it can be a long, hard battle for women.
100%. And available at decentmed.org/menopause, we have the 20 symptoms of endometriosis. And this is obviously not limited, but severe menstrual cramps, chronic pelvic pain, pain during intercourse or dyspareunia, lower back pain, leg or sciatic pain, painful ovulation or middle smirch, pain with exercise, abdominal bloating, painful bowel movements, cyclical diarrhea or constipation, nausea and vomiting, cyclical rectal bleeding, painful urination, urinary urgency and frequency, bladder pressure, heavy menstrual bleeding, irregular spotting, infertility or difficulty conceiving, chronic fatigue, and mood alterations and anxiety. That's available according to AI. So looking at those symptoms, well, the question becomes, Dr. Brown, why, in your opinion, do you feel like this disease is missed so much, even if imaging appears normal? Why can someone have endometriosis even if it looks normal?
Well, these lesions can hide, and they can be virtually anywhere in the body. So people think just because you scan the body that you're going to find 100% of things, but any surgeon will tell you oftentimes, actually when they open you up and get in there, this is when they actually find some things. They're like, wow, it's worse than I thought, or we found some other things that the scans didn't pick up, right? Because you're slicing the body, when you're looking at these images. So you're not looking at 100% of the body with these pictures. So they're slices, and so you can miss these lesions. And like I said, these lesions, they're small, they can hide, they can be anywhere, tucked in somewhere, they can grow anywhere. And that's why it's so painful. And that's why some of their symptoms can be so strange, because those lesions can be creating inflammation and pain and organ damage, so it's not functioning well in many parts of the body. And so if it's in the chest or the lungs, nobody's thinking endometriosis. That could be in the thoracic region, abdominal cavity. Your GI is not thinking endometriosis. If it's in the abdominal organs, if it's causing sciatic pain, you're thinking orthopedic. See a chiropractor. You're not thinking that this is a lesion, that's wrapped around the sciatic nerve. You're not really seeing that. And so that's why it's going to be hard to diagnose, because those lesions can be anywhere, in the body for the most part. And like I said, they can be be hidden in places, and you're not going to be able to see them, oftentimes until you actually, if you're inside the body, opening them up, which is obviously not really an option, so that's why.
Thank you for sharing. And what's so interesting to your point about what people get wrong about it and why it's so misunderstood is we're talking about a disease that affects 10% of the total reproductive age when it comes to women. We're talking about over close to 200 million women. That's more than all of the women in the United States that deal with this. Yet traditional medicine has failed to address it in a proper context. And that's what I love so much about holistic medicine and functional medicine is the work that you do to address diseases and conditions that have either gone misdiagnosed, or people have gone to multiple doctors and physicians and they have not been able to figure out the why behind what is going on. So why do you think that is, in your opinion?
Well, when it comes to hormones, there, especially with women's hormones, we're looking at the sex hormones. That's really not a specialty. Um, Endocrinology really focuses on diabetes, testosterone. Urology looks at urology with men. Gynecologists basically, is birth control, delivering babies, gynecological disorders. But really, there's no specialty per se that's recognized by the AMA when it comes to, dealing with hormone imbalances, and that's why the mainstay of treatment is birth control. It's not about learning how to test, look at the reference ranges, understand how to balance hormones, how to optimize hormones. It's not something that's taught in school, not in residency, not until you're outside, where you do additional training, where you can learn and understand, how this all works and how you can actually help women who are having hormone imbalances. And so it's not taught in schools. The drug companies are funding everybody, as far as the medical schools, residency programs, continuing education classes. Those are, funded by drug companies. And so the drug companies have no interest because it doesn't involve them if you're learning how to, balance women's hormones. So a condition like endometriosis, which is a systemic, really a complex inflammatory disorder that affects, everything, your immune system, your gut health, the hormones, toxins, the whole shebang. That has really nothing to do with drug, therapy. It's about learning how to help the body to clean the mess up, right? To get rid of stuff, to give the body back what it needs, to help with, gut health. Those are not, drug, issues, right? So you got to have a holistic approach when it comes to hormone imbalances, because usually it's not just, it's not the hormones, it's something that led to the hormones being off. And that's what you have to understand and look for. What created that hormone imbalance in the first place? The hormones just didn't one day wake up and just become out of balance. There's things that led up to that. And so that requires more of a holistic approach to look under the hood and figure, okay, where did that start? And so that's where the problem lies. It's not something that is going to be taught in schools because it's not a disease, per se, that requires, drug or surgery to fix that disease. This is something outside of that scope.
And then when you think about the idea of society and the fact that, and I spoke with a provider about this the other day, and they were saying that women have really not been tested on, right? When you look at test and look at the history of medicine, typically it's tested for men.
Yep.
And then the expectation is that women will deal with it or whatever it may be. Speaking on expectations, there's another expectation that society tends to have about painful menstruation and painful periods is that, and you've spoke about this before in some of your previous seminars, because women deal with childbirth, because women deal with periods, essentially they're expected to deal with a painful period or painful menstruation. Is that a proper expectation? And if not, what is?
Well, you said expectation. I find a lot of women expect, especially if they already have painful periods, that that's what they're going to suffer with for the rest of their lives until they hit menopause. I think that people are not surprised when someone has, painful periods. And so when you say expect, you could say that, right? Because it's so common, people have normalized it. And I've always said that no, just because it's common does not make it normal. And I think that's an association because of childbearing. That we know is a painful, experience is when a woman gives birth. And so they just translate that, to the regular menstrual cycle. But that's the body's way of saying that, there's something going on and we need to pay attention to that. And unfortunately, it is not. It's just accepted, tell women just to, take a pain pill, lay down, get pregnant, whatever they've been told to, deal with the issue. But they're not really understanding how painful, how debilitating, this is for certain women, especially with endometriosis or adenomyosis. It's next level pain that we as men can't even comprehend. So unfortunately, that narrative is out there And, a lot of us are doing our best to change, that narrative, let them know that, hey, this is not normal. It's something that should not be, accepted. And there are ways that we can, improve upon this. And it's just a matter of working with women to figure out, okay, why is this a problem? What's happening there, and without the drugs, because obviously you can take a pain medication to help deal with it, but it's not solving the problem. You still got to keep taking it, and it's short lived. But having a holistic approach to see where is the inflammation coming from, where is the damage occurring, because that's what the body's signal is, pain, telling you that there's damage that's occurring or is about to happen. Obviously, we know with childbirth, well, yeah, you have the baby, ripping through the canal. So of course that's going to be, painful, but a regular menstrual cycle of just shedding, that should be painless. But unfortunately, a lot of women have the PMS symptoms and the painful periods, and that should not occur. And having a painless period, that's the goal. And that's a goal that every woman should have, because you shouldn't have painful periods, and you can achieve that.
Thank you for sharing that. And you're right. The word expectation is not the right word. A better term is that it's become normalized,
Hmm.
where women are told just suck it up and deal with it. And like you said, if you ever seen those simulators, right, where a man puts on a pregnancy simulator, if you've seen those videos, men can barely even handle half typically of those.
I
Or
believe it.
if not, if they get the full blast, they are screaming. I mean, it's horrendous. So you're right. I feel that a lot of men need more compassion and understanding for what these women are going through every single month. So when we talk about symptom management, you brought this up earlier when you talked about how traditional medicine just focuses on symptom management and doesn't focus on the root cause. So if we take that approach for a second, what are some symptoms that a woman should not ignore?
Well, the first, we just spoke about it. If you're having painful periods that require you to take medication to help you deal with it, that's a symptom you should not ignore, right? If you're having to miss work or, plans or school, if you're in that much pain, you shouldn't ignore that. That means there's something deeper that's going on. That's first. The second one, if you're having anxiety or depression out of nowhere, like there's no reason to have that, that's something that you shouldn't ignore either, because that could definitely be a hormonal imbalance or other things, creating that. If you're exhausted, even if you got 8, 9, 10 hours of sleep, just have this unrelenting fatigue, that's also a sign of, something going on there, some deficiency, some imbalance that needs to be addressed. And if you have some significant bloating, severe constipation, some severe gastrointestinal, issues, that can be serious. And so those are other symptoms that you should not ignore. So if you're having those symptoms, you definitely need to, get that checked out, because that could be a symptom of something, more serious underlying.
I'm glad that you brought up the mental health side of this because, again, I feel like when it comes to the mental health side of it, and you touched on this at the beginning, they're just put on the antidepressants versus understanding that the mental health side could be due to a hormone imbalance, for example. And there's so many ways that physical health and mental health are correlated. And in our last couple summits, we talked about physical health relation to mental health. And now these next couple summits, we're moving into more physical health and health when it comes to different body systems. So speaking on this Women Health Summit and you being the headliner, why should someone join this health summit on Tuesday?
Well, I'm excited because, like I said, too many women suffer unnecessarily. And this summit is going to address hormone imbalances, different speakers touching on, different aspects of women's health. And if you're suffering from anything, you know, PMS, PMDD, perimenopause, menopause, postmenopause, the pelvic pain, endometriosis, adenomyosis, maybe you haven't even been diagnosed, but you're suffering. If you have the fatigue I spoke about or gastrointestinal problems, we're going to be addressing these concerns. telling you what possibly could be going on, what are the causes of it, and ways that you can approach, your symptoms and things that you can do at home to help you to feel better. So I'm very excited to, share my information. I know the other speakers are excited as well. We hope this would be, very entertaining, interesting, and that people come away with, a lot of good nuggets that they can apply, to their health.
Thank you so much, Dr. Brown, for your insights. You can find the full summit on Tuesday, July 28th from 12 p.m. Eastern to 7 p.m. Eastern, with Dr. Brown being our last speaker at 7 p.m. It will be live on YouTube, and you can catch the recording on More Active. Thank you, and see you on Tuesday.
All right. Thank you.